We've worked really hard to get a good team of employees around us. We have some medical assistants, we have an office manager, then we have 2 nurse practitioners, and that's been an invaluable piece of our office.
My name is Sarah Bluth. I am a medical assistant for Midtown Urology Associates here in Austin, Texas. The main roles of a medical assistant is a little bit of front office, having some administrative skills, as well as back office and having clinical skills. So a lot of rooming patients for the providers, vitaling them, drawing blood, running analysis in the lab on their urines, and also just assisting with minor procedures in office as well.
I'll let Dr. Trotter know you're ready, and we'll be right with you next, okay? Thank you.
I think even just starting off, I think a medical assistant is a great position, even just to start off and get your feet wet in the medical field. You can learn a variety of different skills that you can use in a lot of different specialties as well.
I'm Greg Connor, and I'm a radiologist here in Austin, Texas with the Austin Radiological Association. I enjoy getting to play a role as a part of the team in diagnosing this disease process and helping physicians decide what the next appropriate treatment is. And that always appealed to me about radiology, is the fact that I can continue to play a role in the diagnosis and treatment of nephrolithiasis one day. Here we go. I start to see the first sign of a stone. This is a very small stone and a very small minor calyx to the upper pole of the left kidney. And the next day, I might do the same thing when it comes to musculoskeletal orthopedic injuries.
I'm Paul Godin. I'm an anatomic pathologist. So as a child, I was always interested in the sciences. And in fact, I remember in my room, I had a chemistry set and a dissection table that my parents put in my bedroom. So I think, I had an interest, but I also think I had parents that really indulged my interests and really cultivated an interest in medicine. Even though no one in my family was in medicine. I am so fortunate to work with incredibly smart people. It's not only the physicians I work with, it's the technologists, it's all the support staff. I'm stimulated every day I come to work.
My name is Andrew Barger. I'm a clinical nurse specialist. A clinical nurse specialist is an advanced practice nurse. We can order labs, order medications, imaging, see patients, do all the daily office activities here. Yes, there's the medical side of it. Yes, there's treating folks and using my scientific knowledge and medical knowledge to help them. But most of it is connecting with the patient, learning about them and their background, and really forging that relationship. As a nurse practitioner, as an advanced practice nurse, that's where your heart and mind are. So have you had any pain on the flank at all?
I guess so, but I figured it was maybe a muscle pull or something.
Okay, but mainly on the front. This is my second career. I have a degree in psychology. My mom was a nurse, my grandmother's a nurse, and so I decided to get into nursing. It was really the perfect fit for me.
My name is Michael Trotter, and I'm a solo practice urologist in Austin. The biggest reason that I went to urology is you go through medical school and all these rotations, and the ones that I kept enjoying the most, which had the most fun, seemed to be the urologist. And there's very few specialties that you're able to follow patients throughout their entire life. Kidney stones, for instance, is a lifelong disease, and so you establish relationships with these patients.
Good morning.
You made it in. Life must be good.
It is.
You get a very unique combination of patient relationships and the ability to continue to do surgical related procedures, and that makes it very unique compared to a lot of other medical practices.
Try to drink a lot.
I treat patients the same way that I would like to be treated, and it really goes a long way with the empathy. Empathy is a very difficult thing for people to know how to express when you haven't gone through it yourself. You are doing a good job. It's actually 99% you.
Oh, okay.
And so that in itself is a huge part of how we manage our practice around here.